Welcome to ChiroSphere, where we talk about all things chiropractic and some things, well, not so chiropractic. I'm Dr. Ray Foxworth, your host for ChiroSphere and CEO of Chiro Health USA, the network that works for chiropractic. Today, we're excited to welcome Dr. Gregg Friedman. Dr. Friedman's more than a seasoned practitioner. He's a gifted educator with over 25 years' experience teaching documentation and coding to chiropractors nationwide. Known for transforming what might seem like a dry topic into an entertaining and engaging experience, he's earned a reputation for making rooms full of chiropractors laugh while they learn. Greg, I usually have them falling asleep in the back of the class, so I can learn a thing or two from you. That or watching Netflix.
Right.
In addition to his teaching, Dr. Friedman consults with insurance companies, attorneys, state boards, and chiropractic colleges, sharing his expertise to improve processes and outcomes. A professional speaker who's competed and won numerous motivational and humorous speaking competitions, we're in for a treat today. So welcome, Greg.
Thank you for having me, Ray.
Absolutely. We were just talking before we went live. I was thinking Greg was in cold weather the way he's dressed, and he's in Arizona. I'm in Mississippi, and it is 32 degrees for no apparent reason whatsoever. Low today is 23, and it's just like, it serves no purpose here. So
Right.
I hope you're enjoying warmer weather where you are.
Our high this week is in the 60s, but anything under 70, we're all wearing sweatshirts and jackets.
Oh, poor baby.
I know, right?
So, Greg, you've been teaching documentation and coding for 25 years. We kind of been around probably the same amount of time. What was it that got you involved in teaching that subject? And why do you think it's so critical for us for chiropractors to master?
Great question, and I promise you, it's not my choice. of all the topics to talk about, this is not one of the ones I would have ever chosen.
Wow.
And it occurred because of a personal experience I had. Because back when I started practicing in 1987, we all used travel cards.
Yeah.
Basically because there were no personal computers yet.
Mm-hmm.
And there certainly wasn't any software yet. So we all used travel cards and we didn't know really what to document. So we would scribble a bunch of nonsense like TTF, taut and tender fibers. Whenever I see that today, I'm like, oh yeah, you're from the 90s or before the taut and tender fibers.
Yeah.
So it was just a bunch of nonsense. But you know what? It never was questioned. Nobody ever looked at it. Even for personal injury cases, nobody cared. For PI cases, we would basically send our bill and it all got paid. They never asked for our records. And then one day I get a letter from an auto insurer asking me for my records. I'm like, what? So I called them and I said, what are you looking for? And they said, the stuff that you write down if you visit. I said, well, good luck with that. I can't read them, and I wrote them.
Check, paid cash, paid.
Yeah, what do you want to do? Well, we want to make sure that you establish medical necessity. And I was like, what's that?
I'm a chiropractor.
We didn't know.
Yeah.
So at the end of that conversation, I'm like, I better figure this out because I didn't know if this was just a one-off. I'll never see it again, or if this is the beginning of a trend. So
Wow.
I figured I better do some research. I figured it'd take me 2 weeks to research it. It'd take me 3 years.
Wow.
3 years, and it was awful. And what's interesting is, do you remember Greg Stanley, Whitehall Management?
I've sat in many of Greg Stanley's classes back in the day.
So many years ago, after I learned
Whitehall Management.
Yeah. After I learned what I could about documentation and I started implementing it with very good results, somebody asked him to interview me. At the time, he had a subscription service. He would interview different people in the profession and put the interview on a cassette tape.
I have them.
The cassette tape. Yeah. There's one doctor in Washington State that still has a cassette tape.
Wow.
I said, you need to get a newer car. Anyway.
Crazy.
He interviewed me as a favor. I go into his studio because he was in Arizona. I go into his studio and this is how he greets me. Greg, I'm doing this as a favor. I don't really know that there's anything you have to say that will have any meaning to the profession. So we'll do an hour. If I get 10 minutes of useful information, I'll put it on the B side of someone else's interview.
Wow.
I was like,
you've
okay.
arrived.
All right. Yeah. I'm somebody now.
Yeah.
So he starts the interview and he's reading his questions off of these note cards. And I'm answering them. And then I must have answered one question a certain way. And he said, wait, say that again. So I repeated it. And now he goes off script. And then he's asking me more pertinent questions about what I discovered.
Mm-hmm.
And it became a whole different interview. At the end of it all, we did an hour. He yells back to his sound engineer, I found it. I found it. I was like, what did you find? He looked at me and he said, I've thought for years that there was this chasm between what chiropractors do and what the rest of the world wants. And there's this chasm that nobody's able to seem to bridge. He said, I think you have. I said, really? So let me ask you a question, Greg. You think what I had to offer today has any meaning to the profession? He said, yeah, sorry about that. So the chasm was because it wasn't just about insurance. It was about the requirements, which transcends insurance. I go crazy when doctors say, oh, I got a document for insurance. I don't care about insurance. You're required to document properly, period. Doesn't matter who's paying for it. I mean, the rules come down to what's from CMS, Medicare, but it's not based on who's paying for it. These are the rules.
Yeah. It's interesting how we have, because I make the same observation, when we talk to doctors about their fees, it's, well, we have a PI fee, a workers' comp fee, a cash fee, yada, yada, yada. And then the same conversation occurs around, well, my documentation for my PI is this, for workers' comp is this, for cash is this. And I go, no. There is no documentation based on payer type. There's documentation based on what needs to be in the record. And, there are fees that are based on what your actual fee should be, not who's paying the bill. And that really just seems something, we've been teaching this stuff for 25, 35, going on 40 years. It's like, when are we going to get it?
Right. Have you not been to a seminar in 25 years?
It's crazy.
Yeah, it's crazy. I run into that all the time. I'm like, hey, who's the best at learning documentation for PI? I'm like, if anybody says, these are their hand, I'm like, they're lying. There's no, I said, there are requirements you got to hit. Now for PI, there's a few other little nuances that you want to add, but the basic foundation is exactly the same. I document exactly the same for my cash paying patients as I do for Medicare, as I do for Blue Cross, as I do for PI with a couple of extra things thrown in for PI, but the basic foundation is the same. And when somebody asks, what's the foundation? I said, it's all about data, numbers, metrics, and it's not unreasonable, right? CMS, the requirements, they just want to know, is your patient's condition that you're treating, is it improving or not with your care? Now, you saying neck pain better, that's not what they mean. They want numbers. They want, well, it was a 6 out of 10, now it's a 5 out of 10. Okay, that's showing something. Or the functional outcome questionnaire improved by 22% in the last 2 weeks. Okay, that's something that we can hang our hat on. And with that information, we could take these metrics as data, and now we could change the world because the world revolves around that data.
Yeah,
that's what we're trying to do.
Yeah. It's interesting whenever we talk about the Mercedes 80s, back then, I mean, you could send in a claim form, not even have an envelope, not even have a stamp on the envelope, and you get a check back. And, it really was almost that easy, like you said. And then when you look at docs or talk to doctors and they say, well, why do they want so damn much documentation? I said, can you imagine getting your American Express bill or whatever comes in and it says, Ray, you owe $2,500, but there's no detail about what the charges were, where they came from. They just expect me to put a check in the mail and send it to Amex or whatever.
Right.
And that's basically, what we're asking insurance companies to do, just pay us. I don't have to worry with all that documentation. It harkens me back to grade school. Remember the math teacher saying, Ray, you got to show your work.
Right.
And that's really what it boils down. So let's go upstream for a minute. I've been at this going on 40 years. My mother and father are both chiropractors, or were, God rest their souls. And Greg, I still have them. I could probably put my hand on them somewhere on this desk, but I tell the story. When my folks were doing documentation, they had a 3x5 card. And on one side, it had the dates of service. And again, better, worse, neck pain. But they had a pretty good little history on that 3x5 card. And on the back side was their financial ledger. And I tell the story. I said, it was interesting in retrospect to watch them go from when we had no insurance in Mississippi at all to where we actually got coverage by insurance. And so they had to change their documentation. So they went from a 3x5 card to a 5x7.
Yeah. Yeah.
So it's really been interesting to watch the transition.
Yeah.
But what do you think is at the root? Because I know a lot of medical doctors. I mean, my practice was in a building with 13 MDs, all spine-related care. And, I practiced at the VA for 4 years, started the chiropractic program there. And I have never sat around a bunch of MDs in either of those settings or any other setting I'm in and heard them talking about their documentation sucks, or they're not, they're having problems with it, or they're having problems getting paid because of their documentation. What is it that you think is inherent in chiropractic training or chiropractic that has us literally 40 years? We got 3 codes under Medicare.
Right.
How complicated can it be? What do you think is the root cause of that, and how do we address that?
So I get this question a lot. How come medical they suck at documentation, like apples and oranges? I said, a medical doctor sees a patient once. They do their exam, their history, and they either prescribe medication or they refer to a specialist. That's what they do. Chiropractors, that's not us. We see the patient 3 times a week or 2 times a week, or whatever it's going to be. So it's a completely different animal with that. The medical doctor, all they've really got to document is, the history of the complaint, and then I prescribe this medication. I'll follow up in 3 months, and we'll see if they're improving or not. Or I'm sending it to the specialist. I'll check back with them in 3 months. We'll see if they're improving or not. But based on the blood work, your analysis, that kind of stuff, different for them than it is for us, right? So with us, like my father practiced for 60 years as a chiropractor, and he had the same story that your parents did. He had a 3x5 index card that included the patient's name, neck pain, adjustment, $3.
Yeah.
That was it. That was it. Now the Mercedes 80s, I tell doctors, it wasn't the Mercedes 80s for everybody. That was if you were in network. So in Arizona back then, it was a very closed network. They maybe allowed 5 chiropractors to be in network with Blue Cross. So those 5 chiropractors got all the patients. We would get an average of 30 new patients a month, just who found us in their Blue Cross. And they had very minor, very, very minimal copay, very minimal deductible, if any at all, and then unlimited chiropractic visits. So reported findings was super easy. We all had massage therapists.
Lay down, yeah.
Yeah. So they're like, hey, you want to get a massage twice a week and an adjustment twice a week? Yeah. And it costs you nothing. Cool. Where do I sign up? All right. And it wasn't unethical. That's what they told us to do. And then it changed. Then it changed from unlimited to unlimited based on medical necessity. We didn't know what that meant, but they didn't really change anything for a few years. And then they changed it and we're like, wait, what? And that changed everything. So, the big change for us is that chiropractors, we still have a lot of chiropractors. I mean, I just started my 38th year of practice. I still see patients just a few hours a week, very small, just a few people I want to see. And, a lot of doctors that have been around as long as we remember the travel card days. In fact, I have patients that I still see after 30 years. If I go back into my records, I could find the travel card. I will not show you what it looked like. Well, that would be embarrassing.
Yeah, I coined the term years and years ago because I've looked at a lot of travel cards, doing utilization review, things like that, and I call them chiroglyphics.
Yeah, that's really what they are.
No, they are like what you would see on.
I've had doctors tell me that they've had instructors tell them at seminars that they want their records to be illegible, so that if they're ever questioned, I'm like, that might be the worst advice I've ever heard. That's just silly.
That advice has probably come from someone who has never been through an audit, a fine,
right,
or a penalty. Sounds good on the surface.
Yeah.
I think to me, and this has been something that I have been concerned about for years, just in the evolution of our colleges, still to this day, not many of them are integrated with other healthcare professions. And because of the insight that I had from being at a spine center and at the VA, I think the big difference and our downfall, if there is one, in our educational model is we don't communicate or collaborate with a lot of other professionals. I mean, we're more so today than we ever have, just in
Right.
general as a profession. But when you're not having to communicate from day one as a medical student or a whatever specialty you go in, you're coming in on the tails of someone who's been communicating with their billers, their coders, other specialists, the labs, the radiology, and so there's a lot of you have to document those things so there's some continuity of care. And I think because of the way our chiropractors are trained, and hopefully it's changing, when you don't have somebody looking up, and I don't mean looking over your shoulder in a negative way, but when you don't have somebody following in your footsteps, trying to figure out what you did and where they can be some continuity of care, you're going to get what we have. So here we are 40 plus years later, still struggling over how do we document 3 codes.
You know, I'm a part of the the ACA's Medicare Advisory Subcommittee, and we're trying to get this bill passed for several years that would treat chiropractors full physician status. So if it passes, they would pay us for everything within our scope, and everybody gets excited about that. And then they ask me, Greg, isn't that great? I'm like, could be, but I have concerns. And they're like what? I said, they've given us 50 years with 3 codes, 50 years. And we don't just suck at those 3 codes. We suck way more than anybody else at our documentation of anyone else in healthcare. If we still suck with just 3 codes, what do you think it's going to be, better or worse, when we can now bill 10 codes? How do you think it's going to work? And I'm concerned because if we keep playing this fast and loose and still continue to suck at it, and now we have more codes to suck at, I'm afraid that other insurances are going to, we're seeing more and more insurance companies following the Medicare. They want us to use the AT modifier, even Blue Cross sometimes. So like, if Medicare gets to the point and they say, you know what, we're done with you. We've given you ample opportunity. We've told you what we expect. We've done audits, given you opportunities. You're still not hardly any better. We're done with you. We're kicking you out. What is Blue Cross going to do? What is that going to do?
Yeah,
they're going to follow suit.
They look for a reason not to pay.
And I'm concerned, Mike. So if we're going to do this, one of the requirements would be, and if Medicare does this, every Medicare provider would be required to take a 2-hour webinar. I'm like, 2 hours? I take 12 hours.
40 years. What's 2 more hours?
2 hours. What are you getting in 2 hours? Oh my! So I'm concerned about that. So I'm like,
it's a double-edged sword. No doubt about it. The challenge is that when I because I have kind of observed both professions, being involved with both. The challenge that I think a lot of us have is we're mostly small practices, 1 or 2 doctors.
Yeah.
We don't have the billers, we don't have the coders, we don't. We don't have the paraprofessionals around us that the medical community does. So when you talk to them, my gut is most of the neurosurgeons, orthopedics, physical medicine, you ask them what code is this, that, they don't have a freaking clue. They
have
do
auditors.
what they do, and then somebody else reads their notes,
right,
and documents what they did and turns it into an ICD-9 and to a CPT code. And I guess that's why we've got to spend more time on it. So
yeah, I agree.
So
I agree.
You're known for your motivational and humorous speaking competitions and winning some of those. And I know you've wrapped that into your presentations, which is a feat in and of itself. Why do you think it's so effective in teaching documentation to wrap in some humor?
Documentation has got to be one of the worst subjects in the history of all subjects. It is very dry. It is very boring. And it's critical. It's critical information. And my concern was, if I just play this straight and just lecture for all this time, I'm going to put people asleep and they're going to learn nothing.
Yeah.
They'll learn nothing. And the only way that I can figure to keep people awake is to keep them engaged. And that's when I started incorporating movie clips, television clips, music clips into my presentations, because that affects the brain in a different way. And it keeps the audience wondering, I mean, every time I watch a movie now, Ray, I'm not just watching for entertainment. I'm watching for,
Clips.
ooh, that's a good clip I could use. I could use it. I did a presentation recently, and I added in a new music clip from a singer from the 70s called Meatloaf.
I'm familiar.
That is now part of my presentation, a Meatloaf song. So it keeps as long as it keeps my audience laughing occasionally, looking forward to another clip, it helps keep them awake.
Yeah. There got to be some chemical reactions going on in the brain.
There's got to be something going on, because otherwise,
information.
Otherwise, I'll fall asleep.
Yeah. Well, hang tight, everyone, while we take a quick break to hear from our sponsors. Welcome back to our podcast with Dr. Gregg Friedman. So let's talk about some of your work that you've done with insurance companies, attorneys, and state boards. What's the most common issues that you're asked to address, say, with state boards?
So state boards, this is an interesting one, because you think, is a patient going to complain to their state board about their chiropractor not documenting well? That doesn't come up. It could be an insurance company. They got your bills, they audit your records, and they don't like what they see, and they file a complaint. But the bigger thing that I've seen is that many of the state boards have a protocol of what happens when they get a complaint, any kind of complaint from a patient. And step number one is to request the records. Even if that had nothing to do with the complaint, request the records. And if they find fault with it, they open up a new investigation. And we're like, I heard from a chiropractor a couple of years ago. He got popped by the board for patient abandonment.
That's unusual.
Yeah. So he called me. I'm like, what did you do? And he goes, the patient was non-compliant, and I got fed up with her. I said, did you give her 3 names of other doctors that you don't like? He said, no, maybe 1. I'm like, you got to give him 3. He said, well, yeah, but since then, they asked me for my records for that patient and 10 others. Mm-hmm. They ended up dismissing the patient abandonment case, but they opened poor documentation, which is considered by the boards as unprofessional conduct. So now he's got to go and take seminars on documentation. He's got to hire a monitor for a few $1,000s a year to look at his stuff every month. I'm like, so I see that quite a bit from those things.
Yeah, I think what a lot of doctors don't realize. Well, I just taught in Kansas City a couple of months back, and somebody asked me, he said, well, how many chiropractors do you know that have been fined or penalized just because they had a dual fee schedule? Or, pick whatever infraction you want, or false claim act. And the reality, there are people who have really screwed up big time, but the vast majority, and what doctors don't realize is the vast majority of complaints to boards of examiners from patients is not over your clinical care. It's not over malpractice. It usually boils down to dollars and cents.
Money.
You piss somebody off, you hurt their feelings. We had a case here in Mississippi. I spent 13 hours in a board of examiners meeting with this doctor who's a brilliant guy, smart. He's one of the smartest guys I know, but he was doing a prepaid plan. Lady dropped out of care early, wanted her money back. He didn't want to give it back because he had just the right contract, and he did. But, at the end of the day, Blue Cross is in the room, the state attorney general's in the room, and it's like, and it turned into one of those, this lady, all she wanted was the rest of her money back, and he was going to charge her actual fee rather than the reduced amount. And he ticked off the wrong lady. And at the end of the day, 10 more files, Blue Cross asked for their files. And what doctors don't realize sometimes is, guess who Blue Cross auditors know? Cigna and Aetna and Medicare. They kind of run in the same circle.
All the same.
And so, what you think may not be a big deal it can turn into a big deal once they get their foot into the door, and rarely is it what they originally came in for. And so, that's why it's important just to, make sure you're not abandoning people or ghosting them or quiet quitting. I guess that's the term these days. But it's the little stuff like that ends up, really, really ticking people off.
I do a 2-hour class on medical errors, and one of my first 5 slides is, you want to know how to avoid malpractice? Don't be a dick. That's
That probably sums it up.
Don't be a dick about it. I said, you know what? You want to play hardball with a patient? Have at it, but be willing to accept the consequences. Just be kind, be nice. The prepaid plans, I remember when that started. I can pinpoint it to who started it. And I used to do them years ago. And the reason why the prepaid plans came up back then was because chiropractors have always sucked as a profession at getting new patients, right? It was easy when we got them all from the in-network insurance. I didn't have to market at all. They just came in. But if you weren't in network with that, you're doing a mall show, a health fair, trying to meet people. And, the more charismatic and the better salesperson you are, the bigger practice you tended to build. But not everybody's like that. So these consultants said, all right, if you're not good at getting new patients, then we need to find a way to get you to keep the ones that you do get. And that's where the long-term plans came in. And we were able to, we started off with a treatment plan that was completely made up, backed by no sides whatsoever, right? 3 times a week for 8 weeks, twice a week for this long. And we all did that, right? Because we didn't know any other way. And because at that time, patients had very minimal copays and deductibles. So they were paying $5, $10 out of pocket. They could afford them. Well, now I've got patients, they may have an $80 copay or whatever the allowable fee is for me, whichever is less, but still they're paying $30 or more out of pocket. You want to charge a patient $30 per visit, see them 3 times a week. Okay, what is that? 30, 60, 90 a week is for it. That's $360 a month they're paying out of pocket. I don't know that a lot of people are affording that right now. So it kind of changed that way. But those prepaid plans, a lot of state boards now say, you got to put that money into an escrow thing, and then you pull it out as you do that. Yeah, there's a few states that do that. I'm like, that's a killer. And there are still consulting groups that recommend that. I'm like, man, be careful with that. That's because you send that to me to review the records, I'll crush it.
Yeah.
That's a problem.
It's like anything else. I think the whole intent behind the prepaid plans is, as the saying goes, get the money out of the way. And again, the problem is when you look at the problem occurs from the financial side is when you collect the money up front before the services are rendered, because then you're actually assuming risk. And there are many states where the Department of Insurance says, if you're doing that, you were involved in the business of insurance. And I tell docs, there is such an easy fix for this. It's called get a credit card on file or a checking account on file and collect in arrears. Then whether you're collecting $100 at the first of the month or the end of the month, it's still $100. You change the complete dynamics when you're collecting after services rendered. Now they're paying on a bill. They haven't paid anything for services that haven't been rendered. You'll never be accused of being in the business of insurance. And let's face it, when it's on auto debit, it's out of sight, out of mind. I jokingly tell people I was a member of 3 different gyms for 2 years. I felt great. I never went to any one of them. They were all on auto debit. I'm not encouraging us to do that, but that is the power of finding something that's affordable for people, make the care recommendations that you need to, and just change the mechanics of when you're collecting it. If you're in a state where you're having problems like that, 'cause there's always a workaround. And I think people do appreciate that, not having to, having it automated. Geez, almost everything we do these days is automated.
Quick and easy and affordable. And that's really what it boils down to. I mean, I've had patients over the years that would say, hey, I just want to come in once a month or twice a month for maintenance. Can I do that? Sure. I said, you got to pay for that. And then sometimes they would say, if I prepay for 12 visits in a year, could I get a discount? I'm like, for maintenance? Yeah, I could discount a little bit. So they may prepay that. And in my state, I'm able to do that with that. Doctors who, they don't quite understand the dual fee schedule. So the dual fee schedule thing is an interesting animal because I had, back in August, I took a flight from, I was at FCA in Orlando, and I had to fly back to Phoenix. I connected in Dallas. While in Dallas, I was wearing shorts. I looked down at my legs, and I thought, ruh-roh, I think I know what that is. I diagnosed myself with a DVT. And if I was smart, I would have taken myself to the hospital in Dallas. But I'm not so smart. I wanted to get home. So I get on a plane. I'm taking my pulse. I'm moving my feet. I get everything going on. My wife picked me up, and I'm like, hey, great to see you. Take me to the hospital.
The hospital.
And they got me in right away. They did an ultrasound. I had a DVT. Do that. I just spent 2 days in the hospital. I don't use traditional health insurance. I use Christian Healthcare Ministries. Now, they asked me, who's your insurance? I said, I have no insurance. Without blinking, the hospital says to me, oh, well, let's see if we get you on Medicaid. Yeah, that's not going to work. I make too much money for that. I said, oh, okay, we'll put you on our cash thing. I said, what's a cash thing? It's a 78% discount. I didn't even ask for it. 78% discount? Isn't that a dual fee schedule? They don't care.
Interestingly enough, though, Greg, because I have this conversation all the time because of the business we're involved in, and what people fail to realize, and this is crazy, and I've heard Kathy say this before, healthcare is the second most regulated entity only behind the environment. And the problem is, not a lot of us don't understand that there are Part A providers, Part B providers, ambulatory surgery centers, go on down the list. And the rules and regulations that apply to hospitals and what they can do like that and to a Part B provider are entirely different.
Yeah.
Like my dad used to say, well, that ain't right, but it's true.
Yeah.
And that absolutely, MRI centers do it. But it really is the category of provider or the setting that you're in that allows you to do some,
My hospital bill for 2 days was $54,000.
Oh, it's nuts. Isn't it crazy?
They reduced it to 12.
Jeez.
And then my healthcare share program paid the entire thing, 12,000. Like, wow. But yeah, you're right. We're lower down on the totem pole for that one. So, but back in the day, I remember many years ago, we would in our software programs for billing, we would try to make it easy on our staff. So we would put in each insurance company's allowable fee schedule. That way, there was less write-offs to be done.
You bet.
All right.
That's one way of doing it for sure.
That's the way we do it. Well, nowadays we tell people, okay, don't do that anymore. Like, why not? Said, unintended consequence. What happens is the insurance company, when they look to see about if their fees are appropriate for us, they look at what we billed them. And we're like, oh, well, they're only charging that much. We're good.
Absolutely. Yep.
So I'm like, you need to have one fee schedule that is meaningful. I mean, I said, what goes in your fee schedule? I said, you got to figure out, your level of experience, your expertise, your demographics of the area. If you're in a
business,
all kinds of things, your overhead, all these things play into it for you. I said, for me, I just use the Medicare fee schedule for my state. And then I figure out what multiplier I want to use.
Mm-hmm. That's a simple way to do it.
Simple way of doing it.
It's done that for years.
I have one fee schedule. I use the same fee schedule for my cash patients, my PI patients, my Medicare patients. And then, I bill Medicare my one fee schedule and they say, yeah, we're not paying that. We only allow this much. And I would say, yeah, I know. I have to write off the difference. Or Blue Cross, we're not paying that. This would allow, yeah, I get it. I'll write off the difference. That's fine. Personal injury,
same thing.
That's my fee schedule. You're paying the whole thing.
Yeah.
I don't have a contract with you. And then when doctors say, well, what if I want a discount? I'm like, now you're getting into that zone. You got to be really, really careful. And it's at the cleanest way to do, I don't mean to make this a plug because I'm on your podcast, but the cleanest way to do this by far is to use
The discount medical plan.
a
It is.
DMPO like that, like ChiroHealth. You know, as
Regulated by the Department of Insurance, just like the Blues, Aetna, and the Cignas, and
people are a member of a group.
Yep.
And you are allowed to charge members of the group this fee schedule. Clean as you could get it. I said, that's really the only way to do it. And then I get pissed off at people because they say, well, I found one that's cheaper. I'm like, cheaper than $50 a year? What?
Yeah, they save it on the first visit. Yeah,
That's ridiculous. I said, and then the other thing is, I said, you got to understand. I said, like when people ask me about malpractice insurance, I only recommend one. I said, because they show up at everything and they contribute money back to the profession. They help fund research. And that's the same thing that I recommend when I'm talking to people about a DMP. I said, honestly, ask this other company, how much are they giving back to the profession? Because I travel all over the country. I'm at all these conventions. I never heard of them. But there's one group that I know very well, and they're always putting money back. They're always doing what they can to help. They're always, now I have a bias there too because I'm on the speakers bureau there, but they never tell me that I have to, I can't sell from the podium, but I'm like, look and see what they're doing for you and the profession. That's how I look at everything.
Yeah. Well, we certainly appreciate that. And I don't know if you know, it's interesting, but we kind of have some similarities. You got into documentation because of something that happened to you, very negative. That's exactly why I started the DMPO. I got reported to my state board of examiners and the attorney general because I was charging more to, say, a state farm than I was to a cash patient. She got ticked off about it and reported me. So, here we are 15 years later, and
best thing that ever happened to you.
Best thing that ever happened to me. At the time, I called it my worst day in practice because,
right.
It's bad. It's just holy. I've always tried to do things the right way. And man, when that happened, it's like, holy crap.
Why are
the Blues, Aetna, and Cignas all able to pay us a different fee? And that's perfectly fine, but I can't have one for my, their cash, uninsured. Anyway, long story. We know what works. We know what doesn't. Just all doing things the right way for the right reasons, and you'll be fine. Let's talk about something that I'm beginning to hear that there's this thing out there. I'm trying to remember how you spell it. I think it's called AI. Where do you see AI technology and the regulations evolving? How do you see that filtering into chiropractic and coding in the next few years, or do you?
Okay, so whenever I see this on social media, hey, anybody using an EHR where I want to do my notes using AI? And I'm like, okay, when I hear you say that, I already know that you don't know how to document because AI ain't going to do that for you. Now, for a medical doctor, that can work. AI can work because medical doctors, it's very variable. A lot of variables, a lot of open-ended comments. Chiropractic, we're about the data. We're about the metrics. I said, you're not looking for AI. You just want to do voice dictation.
Yeah.
Who can you? That's been around for decades.
Yeah, Dragon Dictate. I remember one of the first
Dragon Dictate. And you have to keep repeating yourself.
Yeah. I know.
Dictation. Look.
Idiot.
It was crazy.
You got one of those little submarines.
Now, where I do see AI fitting, now, because I've had high-level meetings with experts in AI, and one of them I said, okay, let's have a challenge. I'm going to document, I need to document this. This is what's required. I'm going to do it my way. You do it your way. See which one's faster. So I said, ready, go. I'm done. For them, it took like 3 minutes. I could do mine in 7 to 10 seconds on average. I'm using data. It's not AI though. Data. Now, for billing and claims and looking at the trends, oh yeah, AI's got a big role in that.
Yeah.
That can be very helpful. If you want to summarize like a narrative report, maybe marketing.
Oh,
great.
Yeah.
Marketing, great AI for that. I'm still amazed. I shouldn't tell you this. I was asked to do a webinar the next week, just a 30-minute webinar on falls, in the elderly and chiropractic. And I'm thinking to myself, I don't have any, I'd have to look this stuff up. So I started looking up. I'm like, well, hang on.
AI. Yeah.
I went to AI and I'm like, create a PowerPoint presentation for me regarding falls in elderly chiropractic care with references and citations. It took about 2 seconds.
Oh, yeah.
And they gave me a 30-minute presentation. 2 seconds. I'm like, wow. Gave me the references, gave me that. And then I was able to take that and craft my own presentation built on that and add some stories and other. But I'm like, that one is
helpful. You know, I don't know if
helpful.
you're aware or not, but we about 6-8 months ago, we launched Chiro AI. And I tell people it's like a chat GPT, but it has a minor in chiropractic because we were able to preload our system with all the stuff that is pertinent to chiropractic. And I did just for, as they say, for shits and giggles. I sat down when we were testing ours. I said, write me a series of 5 emails about the benefits of chiropractic for pregnancy. And so it wrote those unbelievably fast. And then I said, rewrite this in the voice of the mother, rewrite this in the voice of the husband about his wife dealing with the back pain.
brilliant.
I just went crazy. Do this in the voice of Andrew Dice Clay. Do this in the voice of Shakespeare. And I have never laughed so hard.
That was funny.
I was almost tempted to send them out, Greg.
Yes.
Yeah. So
That's so funny.
use it as a tool, not as a replacement. We're constantly learning and studying about that, and I follow a lot of other professions and what's going on in their world, and I just saw something 6 months ago and sent it to a bunch of people that I know that are involved in that world. And Whisper is one of the major medical AI softwares out there for documentation. And their conclusion on one of their studies was it has hallucinations. It literally just makes shit up. No kidding. They took this platform and took it to, I think, to some public meetings, and 8 out of the 10 of the meetings were wrong. Just wrong information. So be careful when you do that.
You know, I had a high-level meeting with a guy who was a PhD in AI.
Yeah.
And I asked him, I said,
okay, so chat GPT?
Yeah, right. I'm like, okay, AI, artificial intelligence, it's not like this information is just up in the universe. Isn't somebody, a human,
at some point
putting information in there? He said, yes. I said, so doesn't that mean there's always going to be an inherent bias? And he said, yes. I'm like, well, what does that do? I said, now for a medical practice, they have things, I don't know if they would consider AI though, where they say, okay, these are the blood work numbers, these are your analysis numbers, give me a differential diagnosis.
Sure. That's helpful.
That's helpful.
Sifting through the data.
Yeah.
Yep.
Do we need that in chiropractic? We still haven't been able to come up with a definition of the word subluxation that we all agree on. So I don't know that that's going to happen for us anytime soon.
Yeah.
So yeah, for marketing,
intelligence for that to happen.
Yeah, marketing, blogs, all that. Oh, that's great for that. But when a doctor says, I want to document using AI, but do you?
Yeah.
Really? It's not, you're thinking about this wrong.
Yeah. So I've got a couple of just for fun questions. Who's your hero and why?
Oh, who's my hero? Okay, this is going to sound interesting coming from me. I would say Jesus Christ is my hero. And you might be thinking, well, Greg, isn't your last name Friedman? It is. I was raised Jewish. And then in 1998, I became Christian. I don't define myself as a Messianic Jew. I don't follow the Jewish traditions that I used to.
Mm-hmm.
But I do believe in Jesus. That would be the one person that if I want to have dinner with one person, I have some questions.
Oh, that'd be an interesting one.
I have some questions.
Yeah. You and me both. I just do.
Like, what's up with tarantula?
Yeah. Why?
Aren't spiders bad enough? You got to put hair on them?
Yeah.
Whose idea was that? Anyway, I got some questions.
The things that make you go, What
Yeah, so
talent do you have that most people don't know about?
I
I
was a
think,
jazz musician.
yep.
I grew up, I played jazz, uh, trumpet and flugelhorn all the way through my undergrad and college. In fact, in my undergrad and college at Arizona State University, I was the only non-music major to be accepted into the jazz band. I have one album recorded. I was in a jazz group in Phoenix in high school, and we recorded an album. This is before there were CDs. So I have one album in my name.
How about that?
I don't like listening. I had a solo. I didn't like it, but it's on the album for all
Yeah.
to hear.
Still playing the banjo?
I have a banjo. I tried coming from a brass instrument where I use three fingers
Mm-hmm.
to go to and I have one line of music to read, to go to a string instrument where I got to have two hands going. And I bailed after
You need
about a
some
year.
AI for banjo. There you go.
The biggest thing, my wife would not let me practice in the house.
I can see that.
So
Well, thanks.
I'm like, all right.
Yeah. Thanks for spending some time with us today, Greg. And thank you all for listening to the ChiroSphere podcast. Please subscribe and share the podcast with your friends. And let us know who you'd like to hear from in the future, what topics you'd like us to cover, and we'll do our best to deliver. If you want to learn more about ChiroHealth USA and how we can help you develop a compliant, profitable discount strategy that will absolutely grow your practice, increase your income and profitability, call us at 888-719-9990 or visit our website at chusa.com, and that's how you spell Chusa, to find out why ChiroHealth USA is the network that works for chiropractic. Thanks again, Greg. Look forward to seeing you on the road, my friend.
Thanks for having me.
You
Great
bet.
time.